Hello, this is Dr. Hall, continuing our first lecture on contraception or birth control, specifically hormonal methods. And so now we're going to move into 19B, which is the mechanism of action of hormonal contraception. In other words, how does hormonal birth control work, right? What does it do to prevent pregnancy? So it was Gregory Pincus who discovered that giving oral progesterone tablets could suppress ovulation. So we have to give ourselves a moment and think about why would this happen? Why would taking an exogenous, meaning from outside of your body, taking it in, an exogenous hormone cause suppression of your own internal system? So if we remember how the menstrual cycle works, and we remember that during the follicular phase, LH and FSH are going to be secreted, which means that the hypothalamus must be signaling the pituitary, right, via GnRH, and then the pituitary is producing LH and FSH, which causes the maturation and development of the follicle. Then we get into that positive feedback loop mid-cycle with LH and estradiol or estrogen that causes ovulation itself. So you also probably remember when we talked about negative feedback. So if there is a lot of sex hormone around, be it estrogen, progesterone, or testosterone, the hypothalamus doesn't really care. The hypothalamus will then say, there's plenty of hormone around, and it will stop making GnRH. Therefore, the anterior pituitary stops making LH and FSH. Therefore, the gonads basically get laid off. They go on furlough. They go quiet, they take a nap, right? So this is negative feedback. By administering a hormone from the outside, then the hypothalamus is like, oh, everybody can go on vacation. So the original birth control pill was a dose of progesterone that was high enough to basically shut down the hypothalamus and the pituitary. And that is what led to there being no ovulation, therefore no possibility of fertilization, implantation, and pregnancy. So those doses were really quite high, about 10 times as much as what we use today. Today we use similar hormones, but in much lower doses. So what we have today, we have three different types of birth control. We have combined hormonal contraception, we have progestin only, and we have non-hormonal. So we're first going to talk about combined hormonal contraception, or CHCs. So this simply means that you have two hormones in the birth control. You have some type of an estrogen and some type of a progestin. And because you have two hormones, we call it a combined method or a combined hormonal contraceptive. In this country, there are three different ways that you can get that combination, that duo of hormones into your body. You can either take them as pills that you swallow. You can get them through a vaginal ring that you place inside the vagina, and the hormone just gets absorbed through the vaginal walls. Or you can put a patch, a medicated patch that has the hormones in it, on your skin, and you can absorb the hormones through your skin. So the two ingredients, so progestin, you'll hear me use that word, it just means it's a synthetic progesterone. So it's actually not the easiest thing to make actual progesterone in the lab. So instead they make similar molecules that we call progestins because they act like progesterone in the body. So different names for them can include norgestimate, desogestrel, levonorgestrel, drospirenone. There's a whole bunch of different ones. And so this is one of the main differences between all the different pill brands in addition to estrogen dose. So progestins are part of combined hormonal contraception. And what they do is that they make the cervical mucus impenetrable to sperm. So you might recall when we talked about ovulation and signs of ovulation that the string sign, right, stringy cervical mucus was a physical sign of ovulation. And what that represents is that the molecules in the cervical mucus start to line themselves up in parallel like this and form channels to make it easy to direct the sperm to where they're supposed to go. right? So you're making pathways for the sperm to swim through. That's what causes that stringiness of the cervical mucus at ovulation, which is exactly when you want the sperm to be able to get through. If you're taking progestins, or during times in your own cycle when progesterone levels are high, what happens is that the molecules in that cervical mucus are all haphazard and all arranged every which way, and they're very dense. And so the sperm can't get through. They're like, ugh, ugh, and they get stuck. They can't actually even get up through the cervix. So this is pretty cool when you think about it, right? It's like kind of putting up a gate at the cervix and not letting any of the sperm in by changing the molecules in that mucus. It's pretty darn cool. So the progestins that we use today may also inhibit ovulation, but it depends on their dose. So most CHCs that we use today have a pretty low dose of progestins, so this is at most a minor effect. This is not the major mechanism of action. There's also some data that progestins may interfere with the cilia of the cells in the fallopian tube. So you might recall when we talked about anatomy and physiology of the female reproductive tract, that inside the fallopian tubes, the cells have these little hair-like projections on them called cilia, right? Like your arms above your head, and they go whoosh, 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 and they create this current, right? They're kind of whipping and moving to encourage the oocyte to travel down the fallopian tube and to the uterus. There's not a lot of data that this is important for contraceptive efficacy, right, for actually preventing pregnancy, and you might actually think it might increase your risk of ectopic pregnancies. So there's not a lot of data on this, so we don't think it's significant. So the main mechanism of progestins, their role, their job, what they do to prevent pregnancy, is they thicken the cervical mucus and make it impenetrable to sperm. That is their major effect. They may also suppress, development of follicles and ovulation via negative feedback. They may interfere with the cilia, but their predominant mechanism of action is thickening the cervical mucus so the sperm cannot get through. And if sperm can't get up through the cervix, they can't get up out into the fallopian tube where the oocyte is. Remember, they have to get there before she dies, which is going to happen in 6 to 8 hours generally. And so if they can't get there, then pregnancy is not going to occur. So another thing about progestins, which is interesting to know, is so these molecules are not exactly progesterone. And so almost all of them also act a little tiny bit like testosterone. We call that intrinsic androgenic activity. So almost all synthetic progestins act a little bit like testosterone as well as acting like progesterone. However, overall, it ends up usually being less androgenic activity than the woman herself normally made in her ovaries. So if you remember, normal production of estrogen requires production of testosterone first, right? And then we convert it to estrogen. So there's always testosterone around in people with ovaries, usually relatively low. So it seems that it's less overall than you would have had. The other thing that's interesting is that when you take CHCs, your body also makes more sex hormone binding globulin, which you might remember from the beginning of the semester is protein which binds to hormones and makes them inactive. So whatever testosterone you do have in your bloodstream when you're taking CHCs or using CHCs is going to be less active because it's going to have more chaperone around. So because of this, the net effect for most people using CHCs is that they have a lower functional testosterone. And so these medicines, all of them, can actually often be effective for treating acne because acne in many cases is a result of testosterone. So lots of different types of birth control of CHCs can be very effective in treating acne, as well as sometimes in helping to treat the excess hair growth that we see in people with polycystic ovarian syndrome. Now, what about the estrogens? Why are they there, right? So if the progesterone is thickening the cervical mucus and preventing fertilization from occurring, why do we even have estrogen? Well, I'm going to tell you the main reason is that estrogens are necessary to stabilize the endometrium and prevent irregular bleeding. So I'm going to go straight to the chase on this. So the reason why estrogens are in CHCs is to help prevent irregular bleeding and ensure only regular periods if you're taking it in a way that you would have regular periods. And we'll talk about that later. So there's almost all pills today use a form of synthetic estrogen called ethinyl estradiol. What's nice about that is it's very potent, so you can use really tiny, tiny amounts, which allows for very tiny, tiny pills. And there's all different types of dosages of this ethinyl estradiol, and so that's one of the other differences in one birth control pill versus another. Depending on the amount of ethinyl estradiol present in the pill, it may be causing a little bit of negative feedback and suppressing follicle development and ovulation. But in the really low dose pills for estrogen, it doesn't look like that does that at all. So really the reason that estrogen is there is to help prevent irregular bleeding. That is why it is in CHCs. So how does the pill work? Well, not like the drawing on the left, right? It's more like the one on the right. So the major mechanism of action of progesterone is to thicken the cervical mucus so that the sperm cannot get through. It may also, depending on dose, it may be suppressing ovulation via negative feedback on the hypothalamus, right? And I think this guy here was kind of referring to possible changement in ciliary movement. They didn't get that one quite right, but I thought it was a pretty fun cartoon nevertheless. So the major mechanism of CHCs is making that cervical mucus impenetrable to sperm, preventing fertilization from even taking place. So in summary, right, CHC, we have a progestin, which thickens the cervical mucus, and we have estrogen, which prevents irregular bleeding. So in our next section, we're going to talk about the different methods of CHCs